Sepsis is the most common cause of death in U.S. hospitals. It's the most common reason that people are readmitted to U.S. hospitals. It starts small. It can be just a simple urinary tract infection, walking pneumonia, or it can be more serious like a soft tissue infection or an infection of a bone. And then from there, it spirals and snowballs out of control to a whole body inflammation. Sepsis can affect anybody, like healthy young people or older folks with more serious medical problems. Sepsis is a challenge to diagnose in the best of scenario and even more difficult with folks who may have chronic medical disorders. If you have chronic symptoms, trying to weed through the sand and find a symptom that's attributed to sepsis versus some medical problem that the patient is bringing with them can be a real challenge. We collect millions of data elements or clues on our patients every day in our healthcare system. And what we're looking for is a very precise sequence of data elements to say, hey, this person has sepsis. And we need that key to turn at a very specific time. And to keep an eye and sift through that toy box of pieces and parts truly is beyond something that a human can do.
So we're using an AI algorithm, and the algorithm helps us identify patients that are meeting the criteria for sepsis. As a sepsis alert nurse, I get the alert that the patient has met criteria for sepsis, and then I dive into the chart and I do a chart review and I see, have they met search criteria? Do they have organ dysfunction? We're looking to see if the antibiotics have been ordered, lab work has been ordered, the documentation's been done, they're receiving the proper fluids. Once I've received the alert, I can work one-on-one with the RN to make sure she knows that the patient does have a sepsis alert, to make sure that the bundles are being completed, as in the lab work, the antibiotics, and the IV fluids. We start monitoring for sepsis from the minute they walk in the door in the emergency room. We triage them, so we could start treating sepsis as soon as in the waiting room. We can also start treating sepsis as a patient is an inpatient if they're developing sepsis after they've been admitted. So sepsis never stops. It's a 24-hour, 7-day-a-week response. And we have rapid response nurses as well as the sepsis nurses monitoring this 24 hours a day. Because of the algorithm and the ability to find our sepsis patients, we have been able to cover 4 different ERs as well as 2 hospital systems. We're able to find them and take care of them efficiently and at the exact moment they're showing these symptoms.
Sepsis mortality at Summa is one of the lowest in the state of Ohio and one of the lowest in the United States. Our 30-day readmission is one of the lowest in the state of Ohio and one of the lowest in the United States. We continue to move the bar and are one of our region's best hospitals to come with this very common and very deadly disease.